नमस्कार दोस्तों, वेलकम to channel Toxicology on Board. In this video, we'll be discussing about yet another topic that is four types of hypersensitivity reaction. So let's directly dive into the question with respect to this hypersensitivity reaction. The question is the question is taken from American Board of Toxicology. There are a set of 50 questions were there which were uploaded in the ABT website, which are no longer available now. So from that series of 50 questions, this is another question. So this question is given by the DABT itself. So what feature is common to all four types of hypersensitivity reaction? So we all know that there are four types of hypersensitivity reactions are there. Okay, so every type of hypersensitivity reaction, no, there are some specific features are there. Some features are there which are applicable to two types of sensitivities. Okay, so what the question is for this all four types, type 1, type 2, type 3, type 4, one of these options should be matching for all the four types of hypersensitivity reaction. So let's see what are the options. The option is prior antigenic exposure. Option B is prolongation of IgG. Option C is generation of T cells. Option D is production of IgE antibodies. Okay, so the right answer will be in the green text, which is nothing but prior antigenic exposure. So in case of sensitization, you might be aware that there is a slight difference between skin irritation, skin corrosion, as well as skin sensitization, right? In case of sensitization, prior antigenic exposure is needed, whereas in the case of skin irritation, it is a reversible reaction. For example, there is certain chemical applied on the local area on your skin after either by removing of that particular chemical or after certain minutes or hours of exposure, particular reaction, whatever the redness or erythema, it will disappear. So it is a irreversible reaction. Here, in the case of skin irritation, no, it is a local reaction. It is not penetrating inside the skin layers, and it is not reaching the systemic circulation. It's a local reaction. In case of skin corrosion, for example, there are certain chemicals like sodium hydroxide or sulfuric acid or nitric acid, where exposure to that such kind of corrosive chemicals will disrupt your skin layers, and there is a permanent damage. Necrosis of that particular tissue at that particular area, exposed area, will be taking place, because of which your skin barrier that get disrupted. So in that way, skin corrosion is different from skin irritation and skin sensitization. Okay, these whenever you are reading, no, these you have to read together to understand and the difference. Another thing you have to remember, those chemicals which are having corrosive action, for them generally we do not do eye irritation test or eye toxicity test. Yeah, you have to remember in your mind. Even as a study director for preclinical or six pack acute toxicology study also, you have to remember, and from the exam point of view also you have to remember. Okay, so let's not deviate from the question. The right answer was prior antigenic exposure. So what is the explanation which is given by the American Board of Toxicology? We'll see. Explanation and reference: prior antigenic exposure and formation of protein hapten conjugate. So once the antigen is formed, antibody is formed, now there is a conjugate, the complex will be forming. So protein hapten conjugate is a common antecedent to all four types of hypertensive hypersensitivity type reaction. I will give you one assignment. Please go back and see what is the difference between skin sensitization and hypersensitivity. Are these both same? And in coming to sensitization, is respiratory sensitization and skin sensitization are same? How they are differ? That also you go back and read. Okay, in maybe in one of our next video we'll discuss the answers. Okay, so coming to in addition this Clayson in addition, ABT also referred us to go back and check cassette and doll ninth edition, page number 689 as well as 694. Okay, also see figure 1222. Okay, so these are the four types of hypersensitive reactions: type 1, type 2, type 3, and type 4. Okay, type 1 is IgE mediated, type 2 is cytotoxic and IgG and IgM mediated, type 3 is immune complex mediated will be formed, and type 4 is T cell mediated. T helper cell, T cytotoxic cells will be involved. Okay, and you have to remember first three are immediate, last one is delayed type of reaction. And also you have to remember, when compared to when you are reading hypersensitivity reaction, no, the questions you will get, the type of the reaction, they will ask you questions like this: anaphylaxis belongs to which of the four options will give? IgE, IgM, IgA. So you have to choose the what is the right answer for that particular type of example. And here hemolytic anemia is there, serum sickness type 3, rash or Stevens-Johnson syndrome. So like this, they will ask you in the question, Stevens-Johnson belongs to which type of hypersensitivity reaction? So let's read in detail all the four. Okay, I have tried to get this figure 22 in the first slide. They have given no cassette and all. They have given no same reference. This is the table they are asking us to read from the ABT. They are suggesting us. So whenever there is a xenobiotic coming in contact with a protein, antigenic determinant will be formed. Okay, here aptin protein conjugate that was there in the explanation, a native protein and altered protein. This whatever this hapten conjugate complex is formed now, it is causing hypersensitivity reaction. Again, this mechanism of action might be IgE, which is type 1 mediated, antibody dependent cytolysis. Again, this is type 2 dependent, complement dependent cytolysis, type 2 dependent, immune complex mediated type 3, Ig3, fourth one, type 3, you have to remember this complex mediated. This one is cytotoxic as well as this, type 4, that is CD4 plus CD8 plus T cells activated. Type 4 is also cytotoxic, you have to remember, B cells. Okay, coming to native protein, autoimmunity. There are certain cells in our body which will not be able to differentiate between the foreign antigen and native protein, and they will start attacking our own cells. That is autoimmunity, it is called. So this, try to remember this table because this is already given as a reference from the ABT. Okay, any question coming from this area, you should be able to answer is based on this particular decision tree. So let us in detail read what are type 1, type 2, type 3 and type 4. I try to see there are many tables I have come across when I was looking for the literature to keep what is the best one, but I felt that from the Wikipedia, I felt that it is much more, because at the end of the thing, what is important is how much we remember that can be used in the exam. From where we are reading is not important. The what is it? The implication of that particular memory at the time of exam in order to answer the question, that is important. That's why I have stick to Wikipedia. So let's in detail read about each type of hypersensitivity reaction. So type 1, if you see another alternative names, because when you're addressing a certain question in your exam, no, they'll try to confuse you with the different synonyms, different names. So you have to remember that any allergic reaction, any immediate or anaphylactic reactions all belong to type 1. Okay, these are alternative names or synonyms, right? And second one, row you have to see antibodies or the cell mediators which are included in type 1 are IgE. So IgE belongs to type 1 hypersensitivity reaction. So what are the immunological reactions which we come across in type 1 hypersensitivity is it's a fast response. That's why all three you have to remember they are immediate response. So fast response which occurs in minutes. In the first table you have already seen in first slide, less than 30 minutes. Within minutes, with less than 16 minutes, it will show the response rather than multiple hours or days, right? Free antigens cross-linked with IgE. So antigen will be there coming in contact with IgE antibody, and there will be a cross-link will be formed on the mast cells and basophils. This will go and bind to that particular cells, mast cells or basophils, which causes a release of vasoactive biomolecules. Testing can be done via skin test for specific IgE antibody. The type of test is local test, that is skin test. Okay, and the examples, always you have to remember examples. Examiner will try to confuse you, so you have to remember atopy, anaphylaxis, asthma. Asthma also comes under type 1. Eosinophilic granulomatosis with the polyangiitis, this also comes under type 1 hypersensitivity reaction. So let's go to type 2 now. Okay, pause, you can take a screenshot of this particular video, particular slide, and or you can directly read it from the Wikipedia. What is important is remembering. Okay, type 2 is antibody dependent. Okay, first one was IgE dependent. This is antibody dependent. In this case, what is actually, if you look into, there are certain other videos are there where animated videos are there. In this, no, what is happening? Second type, what is happening? Antigen will be there. Antigen will go and bind to the antibody. In first case, what has happened? The antibody will go and bind to the cell. To that polon or antigen will form. Here, antigen will be there. It will go and bind to Y-shaped antibody. This complex will go back and bind to the cell actually. This is how it happens. Okay, antibody IgM, antibody IgG. So these are the two different types of antibodies, IgM as well as IgG. Whereas in the case type 1, IgE will be there. Okay, complement membrane attacks complex, MAC complex will be formed. So antibody IgM and IgE binds to the antigen, right? Antigen is there, it will go and bind to these antibodies, okay, on a target cell, which is actually host cell that is perceived by the immune system as foreign. Actually, it is our own cell, but because of this complex formation, no, our body will unable to identify that cell, and it consider that host cell itself is considering it as a xenobiotic, as a foreign cell, leading to cellular destruction. So it is causing the death of that particular our own cells via the MAC. MAC is membrane attack complex. Testing includes both the direct and indirect Coombs test. So you have to remember, in your question they might ask you one question with respect to Coombs test. So you have to remember that is belongs to type 2 hypersensitivity, or IgG and IgM antibody mediated hypersensitivity reaction. Okay, so let's go into the examples. We have examples: autoimmune hemolytic anemia, rheumatic heart disease, then thrombocytopenia. Fourth one is erythroblastosis fetalis, good pasture syndrome. So one question you will come on good pasture syndrome, Graves disease, myasthenia gravis, and pemphigus, some kind of disease is there. Okay, so let's directly go into third one, that is type 3 hypersensitivity reaction, which is immune complex mediated, right? And here IgG is involved. First one IgE, second one is IgG and IgM, third one is IgG. Okay, here again complement and neutrophils are involved, the type of cell mediators, and the immunological reaction that we come across is antibody IgG. It will bind to the soluble antigen, right? Antibody binds to the antigen, forming a circulating immune complex. This is often deposited on the vessel walls. So there will be artery and vessels for it. It will get deposited on the vessel walls of the joints and as well as in the kidney, initiating a local inflammatory reaction. In the case of kidney as well as in the case of rheumatoid arthritis, joints will be there, and inflammation will be taking place. So the examples which comes under type 3 or IgG immune complex mediated hypersensitivity reactions are serum sickness, rheumatoid arthritis, since in the joints you are seeing inflammatory reaction, arthus reaction. So they will ask you, they will give you in your question, arthus reaction belongs to which type, then you have to remember type 3. Okay, post streptococcal glomerulonephritis, membranous nephropathy, reactive arthritis, lupus nephritis, systemic lupus erythematosus, extrinsic allergic alveolitis, that is hypersensitivity pneumonitis. So these are the different examples. Remember from previous one, good pasture syndrome, fetal that is, I think that one's type 2 belongs to where your what is it, RH antigen, RH, and if mother is RH positive, second first time pregnancy she will be not be getting any reaction, but second time when the mother when the baby is RH negative, already the antigens or antibodies already there in the in the mother's womb, that's why it causes fetal lysis. So RH antigen related one question also you'll get, that will be type 2 hypersensitivity reaction. So like that, examples belongs to which type of hypersensitivity, that you have to remember. Last one is delayed or cell mediated immune memory response. And another name for this is antibody independent or cytotoxic. So which of the following belongs to cytotoxic? Type 4. Like that you have to remember. And the cells which are involved in this type 4 hypersensitivity are cytotoxic T cells as well as T helper cells. Okay, the cytotoxic T cells and T helper cells, specifically Th1 as well as Th17. Uh, that is T helper 1 cells as well as T helper 17 cells. They are activated by an antigen presenting cells. Here APC. APC is antigen presenting cell. When the antigen is presented again in the future, okay, seeing first exposure has taken place. Second time when they are available in the second exposure, the memory Th1 cells will activate macrophages and cause an inflammatory response. Again, here also inflammation is involved. This ultimately can lead to tissue damage. So what are the important examples that you have to remember is contact dermatitis, including urtiol. Urtiol is something poison ivy exposed to certain plants where you'll get local reactions on your skin. No, urtiol induced contact dermatitis, poison ivy rash. Definitely, I'm telling you, they will give you some plant examples where you are getting exposed. They'll ask you that question. So poison ivy you will get, or they'll give you some poison ivy ka some scientific name they'll give you to confuse you. Then Mantox test, then chronic transplant rejection, right? Multiple sclerosis, celiac disease, Hashimoto thyroiditis, granuloma annulare. So these are the different examples. These are the different types of hypersensitive reactions. So definitely this topic will be confused no matter how many. See, these topics no, we have already come across in B pharmacy as well as M pharmacy. You might have studied in microbiology as well as in biotechnology, or you might have studied in the case of immunotoxicology also. Yet you will get confused because these four topics types no always are confusing. You will be thinking it belongs to this or this belongs to that, like that. So try to take a screenshot or from the Wikipedia as well as make a single slide. What I try, how do I remember is that I'll make a single like flash notes you can prepare where you can put all the four types of hypersensitivity. Make a note which of the four belongs to cytotoxic, which are the mediation is there, what type of antibody mediated is there, which one is immediate, which one is delayed, and examples. RH antigen के example, good pasture syndrome, anaphylactic reaction, poison ivy. So these examples you remember. Example belonging to which type of hypersensitivity. Then definitely you will be able to easily answer. You'll not get confused in the exam. Immediately you will be able to, by looking at the question only, you will be able to answer the question. So thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com, and like, subscribe, and follow my YouTube channel Toxicology on Board. Thank you so much. All the best for your exam.